This presentation is intended to educate UK ambulatory clinicians on the importance of Hep C and HIV screening and their linkage to care. It will also explain the ease and utility of the Hep C Collaborative Care Agreement to ensure access to Hep C care following the American Association for Liver Disease and Infectious Disease Society guidelines. Today we are going to discuss how the syndemic of Hep C, HIV, and opioids has disproportionately affected Appalachia, how current models of care have failed to reach treatment levels necessary to eliminate Hep C from the United States. And we are going to present the expansion of a standardized enterprise Hep C care process that can be replicated with your help to achieve state and national elimination. This collaborative care agreement allows specialty pharmacy to pair with healthcare providers in order to provide comprehensive Hep C care following national guidelines. The emergency department began this process in July. Today we will also be looking at their preliminary pre- and post results. Diagnosis to treatment has changed from 421 days to 18 days. Linkage to care has changed from 50% up to 90% within 1 week of changing this process, and treatment rates have increased by 500%. The long-term expansion goals: in 5 years, the enterprise could cure nearly 35,000 Hep C patients and save up to $6.5 billion. The background of HIV explains why screening is so important. HIV prevalence is increasing with nearly 13% undiagnosed. Co-infection of Hep C and HIV is also common. Among Hep C, 5% also have HIV. Among HIV, 15 to 30% also have Hep C. HIV screening has been considered a routine screening test since 2005. By screening routinely, we can hope to connect patients to care quickly to reduce morbidity and transmission. Hepatitis C is considered the silent syndemic affecting Kentucky. Greater than 5 million people have hepatitis C in the U.S. This has more than doubled since 2013. High-risk populations include those aged 20 to 39 years and people who inject drugs. Up to 85% of people go undiagnosed, and that's because usually there are no symptoms. Hepatitis C is the leading cause of liver cancer and cirrhosis-related death, and it causes more deaths than all the 60 other reportable infectious diseases combined, including HIV and TB. Kentucky has 54 of the 220 counties in the nation at highest risk for infectious outbreaks due to injection drug use. Because of the high prevalence of hepatitis C, screening goals have changed. The CDC recommends testing be done at least once in a lifetime for all adults aged 18 years and older. Testing should be done with all pregnant women during each pregnancy, and routinely if ongoing risk factors. There's limited data on the frequency, but it's recommended annually due to hesitancy with risk factor disclosure. Universal screening should be done if a seroprevalence of a population is unknown or greater than 0.1%. This is the case for Kentucky. Therefore, we recommend and have begun a non-targeted screening method. Everyone is offered hepatitis C testing regardless of disclosure of risk. Hepatitis C is only curative with a community-based treatment approach. The goal is to discover the hepatitis C cases that go undiagnosed and rediscover those patients who have not begun treatment and link them to treatment programs. Hepatitis C treatment goals have been set by the National Academy of Science and the USPSTF. The goal is to eradicate hepatitis C by 2030. Cirrhosis is the leading cause of hepatocellular carcinoma, and treatment can decrease the risk of liver cancer by 75% and the all-cause mortality by 50%. Treatment also improves blood sugar levels, which help prevent kidney disease and cardiovascular disease. The first direct-acting antiviral, Harvoni, hit the market in 2014, making treatment easier and more accessible. In 2015, the National Academies of Science and Medicine estimated 260,000 people needed to be treated annually to eliminate Hep C by 2030. Since 2015, insurance companies have removed nearly all barriers to treatment, like lab chronicity, baseline advanced fibrosis or cirrhosis, and sobriety. Yet, treatment rates continue to decline. It makes you wonder, why are people not taking this free, well-tolerated, life-saving treatment? We have found that this is due to poor screening methods and linkage to care.
Maybe patients and providers have faced Hep C treatment barriers in the past and don't realize how simple Hep C treatment has become. For example, Hep C treatment doesn't require a hepatologist, sobriety, chronicity, or baseline cirrhosis. Hep C treatment is covered by insurance, can be initiated within 2 weeks, does not require any lab monitoring, and is well tolerated with little if any side effects. Hep C cure with DAA is achieved in over 95% of patients, and for those who become reinfected, DAA retreatment is available with similar cure rates. The reality is Hep C treatment is indicated for everyone with a detectable RNA who's 3 years and older, who are not pregnant, not breastfeeding, and who have a life expectancy of more than 1 year. Per Hep C national treatment guidelines, non-cirrhotics only require additional labs, while cirrhotics also need an ultrasound if it hasn't been done within the past 6 months to screen for liver cancer. The additional labs will assess for Hep C genotype, Hep B co-infection, previous Hep B exposure, Hep A and B immunity, liver and renal function, and pregnancy for any women of childbearing age who have not had a hysterectomy. So these are the national treatment guidelines. And the UK standard of care also requires a fibroscan before Hep C treatment to more reliably assess liver fibrosis and liver cancer risk. A fibroscan is a non-invasive test that uses transient elastography to assess liver stiffness and steatosis, which is fatty liver. Once the additional labs, fibroscan, and/or ultrasound have been completed, the pharmacist will educate the patient over the phone and arrange for treatment delivery. Typically, treatment is mailed to a patient's home address, and for those in unstable housing, treatment can also be picked up directly from UK Pharmacy. The preferred treatment is Epclusa, also known as Sofvel, which is 1 pill per day for 12 weeks. Most patients report no side effects, but about 20% may report headache and feeling tired, and this is more likely to happen the first 2 weeks of treatment and in those who don't stay hydrated with water or a sports drink. Treatment is covered by insurance with little, if any, out-of-pocket cost, and for those with copays, UK Specialty Pharmacy will utilize any manufacturer coupons and financial assistance to make treatment as affordable as possible. Again, we're talking about a life-saving cure that decreases the risk of liver cancer by 75% and early death by 50%. Take 3 months of treatment and gain 10 years of life. Not only are there minimal Hep C treatment requirements, side effects, and monitoring with great reward, but it's also legal. Some would even argue it's more of a liability to not screen and treat. The UK Specialty Pharmacy Hep C screening and treatment process is a comprehensive, continuous, test-to-treat enterprise standard of Hep C care that utilizes specialty pharmacists through a collaborative care agreement to increase the capacity of ambulatory providers by offloading onto our dedicated team. Pharmacists under the collaborative care agreement operate at the top of their license by performing fibroscans and formulating treatment plans. Each pharmacist has been trained by EchoSense, the fibroscan manufacturer, and each treatment plan is reviewed by the ordering provider before its submission for a prior authorization. We have 3 Hep C and 1 HIV social worker, whose contact info is listed on the last slide. Our social workers are our safety net for patients who fall through the cracks of the system. The social workers are very persistent and creative in their ability to reach and re-engage patients in care, even years later. And if anybody is able to find a patient, it's one of our social workers. You will see in the collaborative care agreement, it also says all UK Hep C lab testing and fibrosis assessment results related to Hep C diagnosis and treatment will be the responsibility of the ambulatory care provider or the specialty pharmacy Hep C provider if requested. This means the treating provider can be an ambulatory provider who is comfortable and competent in Hep C and fibrosis management, or it can be a hepatology-trained Hep C APP if requested. We figure many ambulatory providers may request our APP initially until more experience is gained, especially with cirrhotic patients. This is what the BPA may look like. It is expected to pop up for any clinicians who order any blood lab. Just remember, the standard is annual screening of Hep C and HIV, and if there are no results or negative results more than 1 year old, to simply accept the test. And remember that if the patient is positive, the pharmacist will contact and discuss the results with the patient. These are the preliminary results from the emergency department pre and post specialty pharmacy collaborative care agreement, which went live in June 2023. Since the ED screening began in 2018, over 5,000 treatable Hep C patients have been identified. This means 1 in 10 adult ED patients are Hep C antibody positive. And this is increased even more among the 20 to 39 age group, where the seroprevalence is 20%. Since the Hep C collaborative care agreement went into effect, treatment rates have increased from 10 to 60%, and days from test to treat has dropped from over 400 days to 18 days. Not to mention, 86.5% of patients are on track to complete all 3 months of treatment. We are still new, but we hope to have some SVR or outcome data very soon. Since Epic launched at UK in 2021, UK Ambulatory has screened about 6% of adult patients. By working to decrease your patients' rates of cirrhosis, liver cancer, diabetes, kidney disease, and early death, Hep C treatment will also have many downstream financial benefits for all stakeholders and taxpayers. And the next 2 slides details this.
Take a second to look at this slide on the hepatitis C and HIV treatment 5-year ambulatory sensitivity projection. The total 5-year impact for UK healthcare projects that patients cured be 34,782 patients. UK healthcare revenue, $350 million to $1 billion, and Medicaid and insurance savings, $4.2 to $6.5 billion.
In summary, all adult patients should be screened for Hep C and HIV annually. Clicking Accept on the BPA will trigger the order for screening and any linkage to care. All Hep C lab testing and fibrosis assessment results related to Hep C diagnosis and treatment will be the responsibility of the ambulatory provider or the specialty pharmacy Hep C APP if requested. Click Accept and request that UK Specialty Pharmacy do the rest by signing and supporting the collaborative care agreement.